Protection from overall risk exposure is what we seek to teach you and show you how to do in a consultative relationship-based approach. As we've explained to you the difference between a copay plan and a high deductible plan, there's obviously a little bit more going up with your risk exposure if you choose that higher deductible. So showing you how to keep your costs lower or your exposure minimized, we want to bring to you some key products. One of the things that we found in our research and our studies of being students of our industry is that the majority of your claims and you meeting your deductible is going to come from accidents and critical illness. 70% of all bankruptcies came from medical expenses. So here's the way it broke down. You had a good job with great benefits. You got sick, you couldn't work, you lost your job, and therefore you lost your benefits because you couldn't afford COBRA. It's simple logic, and we don't often think beyond getting that job and what's going to happen to our benefits if we no longer work there. So what we try to do is help you understand how your health insurance really works, and then from there show you where your cost comes from. Then on top of that, we protect that risk, as we know is our deductible and co-insurance, or deductible at 100%. We protect that risk. There's a couple key products that we'll do that with. One is an accident plan. Quite simply, it blankets your risk exposure anytime you have an accident. So if you're an individual that's very active, or you're a family that has a couple of kids and that play some sports, you should have an accident plan blanketing the risk of your deductible and co-insurance. Quite simply, accident plan would run you $44.95 as an individual, $64.95 as a family, something along those lines. If something happens to an individual, it's $195 or $250, depending upon if it's an individual or a family plan. Then when that happens, it's going to pay you $5,000 or $10,000, therefore completely eliminating and negating that deductible. So then you take that money and you pay your family's deductible on your major medical policy, and everything will be covered for the rest of the year, depending upon the plan you are on. But as we said before, most of our clients are on that high deductible HSA plan. That's why we recommend these two plans together. Next would be a critical illness plan. This type plan would cover events such as cancer, stroke, heart attack, kidney failure, coma, paralysis, burns. In the event of one of those things occurring, it's going to pay you a flat fee of $20,000 or $30,000, as much as you care to buy. But what we typically do is provide it to you at twice your deductible. So therefore, if something happened this year, it would cover your deductible this year and next year. So we can explain that further when clarifying what choices we've provided for you and which is going to be best for you. But the purpose of a supplemental product is to negate the risk associated with choosing a higher deductible or just you having a deductible in general that you're responsible for. Because many people today are choosing higher deductible plans to lower their costs, but they didn't understand what they were exposed to as an individual or a family. And as we've already gone over that, when talking about yours or your family's risk exposure, we're just simply wanting you to understand how to protect that risk with very cost-effective products. The next thing to address in this series would be your dental plans or your vision plans. We have a number of different products and solutions based on how many people in your family, how often you're going to the dentist, what type of glasses you're wearing. Are they just bifocals and reading glasses, or are you needing a little more comprehensive vision plans? Each one of these solutions we can cater to you on a permanent basis that's yours. If you leave your employer, or if you're a client of ours on our house company plan, then we can help you out with that for you and customize that solution for you. So stay tuned as we go into our next video, and thank you for watching.